Hello and good evening to all of you. So, today we will be having this new module, Sexual and Reproductive Health. Small module, and important stations will be emergency contraception, and you can have a teenager requesting for termination of pregnancy or emergency contraception. So, you have to maintain the confidentiality. And sexual assault, adult sexual assault, or even child sexual abuse, these stations are there as structured discussion task. New station came that was postcoital bleeding, and one syphilis. That station came when there was that talk, and transgender station that came once where the transgender came with Bartholin's abscess. So for that, I have my voice note. Okay, so let's start with the stations. So, who will do first? Yes,
Ma'am, I was Anita.
Shweta or Anita? Whose voice?
Anita, ma'am.
All right. Okay, come please. Okay. Take your 2 minutes, just one slide.
Ma'am, I'll start.
Yes, start please.
Hello, I'm Dr. Anita, one of the doctors in the gynae clinic. May I confirm your name and age?
Yes, I'm Rebecca Gray and I'm 26-year-old.
How may I call you?
Call me Rebecca.
Rebecca, I'm sorry to meet you in these circumstances and I'm aware of what has happened. So is it, how are you doing at the moment?
Yes, I'm okay.
Do you need any pain or any painkillers you need after ruling out allergy?
No, no. Oh, Anita, your voice is very low. It seems you're talking from far away.
Oh, no. Okay, ma'am. I'll pick it. Okay. So, yeah. Can I
Okay.
continue, ma'am?
Yes.
Rebecca, I'm aware of your situation and I'm sorry to meet you in this situation as such. And how are you doing at the moment?
Yes, I'm okay.
Okay. Do you need any painkiller?
No, no.
Okay. So, Rebecca, today I'll be discussing about what has happened and then I'll take to you to the management also. But and whatever we discuss will be strictly confidential between you and me. Okay. So,
Yes.
if you're okay, can we continue?
Yes.
Okay. So, can you exactly tell me what happened?
Oh, yes. Actually, yesterday, when I was coming back from a late night party, I was surrounded by few men and, they just raped me.
I'm so sorry, Rebecca. Rebecca, do you are there? How they were many men? Any one of you, you know any one of them?
No, no.
Okay. And if you meet, can you recognize any one of them if you see them again?
Maybe, yes. But it was very dark.
Okay, I see. And I am aware you have already seen the SARC unit and
Yes.
met the forensic expert, right?
Yes.
Did they collect any samples?
Uh, yes, they have collected few samples.
Okay. And have you informed the police?
No, no, not yet. I'm so afraid, so much afraid because they threatened me with dire consequences if I inform the police.
Okay, Rebecca, don't worry. We are always here to support you and help you. And at the moment, you are in a safe place and no one can reach you, okay?
Yes.
Okay. So Rebecca, like as you told me, at the time when what type of intercourse was there, whether it's anal, oral, or like vaginal?
Yes, from all the orifices.
Okay. Did they use condom?
I don't remember.
Okay. And did ejaculation happen to you? Are you aware of that?
I think yes.
Any other like bite marks or physically they have abused you?
Yes, yes.
Okay. And any kind of like, are you having any discharge or abnormal bleeding at the moment?
No, no, not now.
Okay. Can you tell me about your periods? When was it last?
7 days ago.
Okay. And like, are your periods regular?
Yes.
And are you using any regular contraception?
No, actually, my partner was using condom on and off.
Mhm. Okay. Anytime, like any other medical conditions, like especially asthma or migraine or any
No,
liver condition?
no, no,
No. Oh. Any, and are you taking any antacids?
no.
Okay. What about do you use tampons or pads has been drawn?
What again?
Any tampon or pad
Uh,
you have with you?
yes, yes. Actually, they have collected in the referral center where I went.
Okay. So Rebecca, before coming to the coming here, have you informed anyone like your family members or any of your friend about this?
I have just informed my partner.
Okay, I see. And are you vaccinated with hepatitis B?
I don't remember actually.
Okay. And where do you live?
Yes, my house is nearby.
Okay, you stay with your partner, right?
Yes.
So any have are you feeling low, depressed, down at the moment?
Oh, yes, actually, I'm not feeling okay.
Yeah, definitely, Rebecca will also feel better.
Mm-hmm.
Is it okay? Mm.
Yes.
So Rebecca, anything else you would like to add?
No.
Okay. And one thing more, are you updated with your smears?
Yes.
Okay. So Rebecca, thank you so much for the information. I'll just, if you allow me in the presence of a chaperone, I would like to examine you. I'll just have a general quick examination. I've been provided with your blood pressure, which is normal, and also with your temperature, which is also normal. But I'll just check from down below to see if there is any abnormal discharge or any bleeding. Is it
Okay.
okay?
Mm-hmm. Yes.
Okay, so coming to the management, Rebecca, first of all, as you told me, uh, you had uh, you had your period 7 days back. So in such situations, generally because you are not under any regular contraception, we need to provide you with some emergency contraception because 5 in 100 women tend to conceive accidentally. Okay.
Mm-hmm.
And also like emergency contraceptions are like as you are into 7 day, all the three options like the two pills as well as the copper coils are available for you.
Okay.
Okay. So generally the copper pills acts by inhibiting ovulation, delaying ovulations, and copper coil act by uh, as a T-shape device which is inserted inside a womb, and they generally prevent fertilization as well as some even implantation in the womb. Okay.
Mm-hmm. Okay.
And whatever preference, do you have any preference as such?
Yes, well, I'll think about it. Maybe I will take the pills.
Okay, okay. And also, we'll also refer you to the sexual health clinics where swab will be taken for sexually transmitted infection. That is after after 2 weeks, and also some blood investigations for some sexually shared infection like HIV, hepatitis will also be taken. Okay.
Mm-hmm.
We'll also check for your protein antibodies for the hepatitis B, and if needed, we'll also vaccinate you with that.
Right. Okay.
And the vaccination course will be, if it's negative, it will be an accelerated course where we will be giving you now, after 1 month and after 2 months. Okay.
Yes.
We'll also provide you with the prophylaxis for HIV, which is generally given within 72 hours and and will be continued for a period of around 4 weeks.
Yes.
This HIV prophylaxis generally has certain side effects, like you may have nausea, vomiting. So we'll follow you up for any side effects within 2 weeks, or every 2 weeks. Okay, if you have any side effect.
Okay.
Rebecca, also as this situation, sometimes you may feel very traumatic and you may have flashbacks. So we'll also get you connected with the counselor to help you out to come out of the situation.
Okay.
I can also provide you with some support links, like the Women Aid or something like the rape victims. All this support group will be available for you. Am I clear to you so far?
Yes.
I will also involve my consultant and the sexual health specialist and the gum physicians, and we'll arrange for your follow-up further with the SARC, where they have all the facilities available, and they evaluate you thoroughly and give you support thoroughly.
Okay.
Okay. So
Yes.
Rebecca, at the note, what about do you feel safe to go at home?
Yes, my partner will come to pick me up after some time.
Okay. So we can arrange those meetings for, we can arrange for that thing. And anytime you have any difficulty, please do come to us. And if you, in case you change your mind to inform the police, please let us know. We are always there to help you and support you. Okay.
Yes.
Okay.
Okay.
Anything else?
Thank you. Okay.
Okay.
Finished on time. All right. And well done. You have covered all the important points. So pass in all domains from my side. Patient safety, yes, you have to ask her whether she feels safe to go home or not. And applied clinical knowledge, yes, you will be talking about the emergency contraceptions, vaccinations, and the follow-up appointment. Communication with patient was absolutely fine. Information gathering part was also fine. Good. Okay.
Ma'am, actually, no, there is some problem. Like I just can't get it. Like she has been to SARC, no?
Yes.
So like SARC is a system where all the things are available. So do we need to send her to separately to the sexual health clinic?
After 3 weeks, we can send her. Yes. Like as of
She'll
now,
go to the she'll go to SARC or she'll go to the separate clinic.
like SARC also has that sexual health clinic. Everything is there. Yes, contraceptives clinic, everything they will discuss. So as the patient has, like she has come to you, so the scenario is here you will discuss about the sexual health clinic. So in the SARC also they have separate clinics. So like if we are talking about the sexual health clinic, so it implies that she can go in that sexual health clinic which is there in the SARC center. She can go there.
Okay.
And since you're a
like
gynae,
the forensic team also, they will be examined in the SARC only, so we don't need to say we'll get an appointment for, because everything has been done for her.
Yes, exactly. Everything has been done. If she has been to SARC, it means examination and everything has been done by the forensic experts. Yes.
Okay.
You just have to give an outline of the management. That's all. Okay. All right. So yes, of course, you have to be very sympathetic and empathetic in this station. Very soft tone. You don't have to rush. There will be a lay examiner sitting and watching you. Okay. So, hello, I'm Dr. Anita, one of the doctors in the gynecology clinic today. May I check your name and age, please? How may I address you? Thank you, Rebecca. I'm really sorry to meet you in this difficult situation, and I'm aware of the events which you have been through. I also want to tell you that you're in safe hands and no one can reach you. We as a team are here to help and support you. And whatever we will discuss will remain confidential. So, confidentiality is a very important patient safety point here. I would like to ask you a few questions. I understand it will be difficult for you, but it will help me to provide you the best of care. Can I proceed? Can you tell me in your own words what exactly happened? I'm sorry to bring back the unpleasant memories. I'm sorry to hear this. It is not your fault at all, and it's a very serious crime, and no woman deserves to be treated like this. Have you informed the police? No. So, do you want to inform now? Still, if she is not ready to inform the police, yes, I respect your wishes. And whenever you change your decision, you can inform us and we can help you to inform the police. Okay. May I know how many men were there? Do you know any one of them? Can you identify them if you see them again? And did they use alcohol or gave you some drugs? Did they use weapon to threaten you? And when and where did it take place? Did they use condoms? Any ejaculation occurred? And did they physically assault you? And like, did they beat you and hit you with the blows or punches? Was it vaginal sex or through back passage or oral sex? And any vaginal discharge or bleeding? May I know when was the last periods? How are your periods otherwise? Have you been using any contraceptives? And did you use any pad or tampon? Are you following GP for any medical condition? Like you asked any like history of migraine, any liver condition? Because I know you are keeping in mind because you have to offer her these emergency contraceptive pills. Are you on any medication? Any allergy to food, drug, or metal? Did you inform anyone in your family or did you inform your partner? So, no need to ask family history of concern. It is whether you have informed any of your family members. May I know whom do you live with and do you have enough support at home? And may I know how have you been feeling lately after this incident? Yes, I can see it is very difficult for you, and we can also put you in touch with the counselors. Will that be okay? How are you coping after the incident? Thanks for these informations. Would you like to add anything important? So, is it okay if I examine you with your permission and in the presence of chaperone to get a feel of your tummy and to see if there is any pain and assess from down below to check if there is any bleeding or discharge? I understand that you have been examined by the experts. So, may I know, did they take the samples or any photo? All right, everything was done. Fine. So, regarding your further care, it's going to be shared care. I will be informing my consultant and we will include team of specialist doctor in your care, the specialist nurse, and the counselors. So, as you know, there is like, I would like to tell you that there is risk of pregnancy after vaginal rape, and it can happen in 5 in 100 women. So, is it okay if I discuss with you about the emergency contraception? We can offer you the contraceptive methods. These are the copper coil or the pills. And may I know, do you have any preferences? Have you heard about them? Do you want to know about the details? So, copper coil, it is inserted inside your womb from down below, and you can continue it further as a birth control method for a long term, that is about 5 to 10 years. It releases the copper, which is toxic to the sperm, and the sperm cannot survive in its presence. Even if the sperm survives, then it prevents the meeting of the sperm and the egg. So the embryo, that is formation of the baby, does not take place. And even if that like embryo is formed, then it will not be implanted inside the womb. Regarding the pills, they act by delaying the release of eggs. And these are effective when taken up to 3 days, that is up to 72 hours, or up to 5 days, that is within 120 hours of the unprotected sex. Any questions? Am I clear so far? Okay, so also tell that these emergency contraceptions, they don't protect against the sexually shared infection. And we will also arrange appointment with the sexual health clinic. So you will be screened for the sexually shared infections and swabs will be taken after 3 weeks. Also, you will be offered the blood test in which to check for the viral infection, that is HIV, hepatitis B, and hepatitis C virus at 3 months. And may I know, have you been tested for the hepatitis B virus? Okay, so we have to check for the hepatitis B immunity. That is, we have to check for the presence of protective antibody against hepatitis B infection. If not present, then we will offer you the rapid vaccination. One dose will be given now, then after 1 month and after 2 months, and another booster dose after 12 months. Also, I would like to know whether you were offered the tetanus toxoid injection. If not, then we can offer you. And also I would like to tell you about the HIV prophylaxis. Medications are given to protect against the HIV infection because we don't know the status of the assailants, whether they had this infection or not. So it is started within 72 hours and it is continued up to 4 weeks. Then we will be arranging the follow-up appointments. It is every 2 weeks if there is no problem with medications, or every week if there is any problem with the medications or any side effects, or if you have any concerns. Any questions so far? And as of now, we can also put you in touch with the counselors so that they will help you to cope with this situation. I will also give you the support group numbers like the rape crisis, women's aid. You can, if you remember one or two, that is enough. I will be documenting our discussion in the case notes. And may I know, do you feel safe to go home? Okay, so your partner will come to take you. That's fine. And if she says no, then of course, you will tell her that in that case, I will be involving the social services and also the safeguarding team. And we are going to make safe arrangements for you stay. Is that okay? Any questions? That's all. The thing is that your communication and information gathering, that will be assessed by the lay examiner in this station. And management part is very short, but you have to include everything: the contraception, the swabs, vaccinations, counselors, whether she feels safe to go home or not, and informing the police once she changes her mind. All right, well done. Okay, next, who will take the next station?
I want to take.
Bushra.
I am Dr. Bushra. Yes.
Fine. Okay. 1 minute. Okay, take your 2 minutes, just one slide.
Okay. Okay, ma'am.
Ready? Start, please.
Yes.
Okay.
Hello, I am Dr. Usha, one of the doctor in the gynae clinic today. May I confirm your name and age, please?
Yes, I'm Ashley David. I'm 36 years old.
Okay, can I call you Ashley?
Yes.
Okay. Ashley, I can understand from your clinical notes you are here because you have been going through the procedure on the neck of the womb. Am I right?
Yes.
Okay. Do you have any other concern?
Yes. Actually, I have a lot of concern. I had unprotected sex 3 days ago. And, my partner and me, we forgot to use any contraceptive. My partner forgot to use the condom. And now I'm afraid I'll be pregnant. And I don't want to have any pregnancy right now. So I want to discuss about some emergency contraception.
Okay, Ashley, I can see you are worried and anxious, but we are here to help you and support you. But before that, can I ask a couple of the questions to better understand your condition, and then we will make the management plan that is mutually agreed and acceptable and safe for you. How does it sound?
Yes, that's okay.
Okay. Okay, Ashley, can you tell me what exactly happened?
Yes, actually, we were in the party 3 days ago, and then like it was unprotected sex. Yeah, that's all.
Okay. And is it any other unprotected sexual intercourse in this cycle?
No.
Okay, and what is the current day of your cycle this time?
I think it is 14th to 15th day of my cycle.
Okay, and your periods are regular?
Yes.
Okay, and do you have any vaginal discharge and uh,
No.
bleeding?
No.
Okay, and any pain below your tummy?
No.
Okay, and Ashley, can I ask some questions that might sound intrusive, but that are important to formulate the better management plan? Can I proceed?
Yes.
Okay, and you and your partner have ever been diagnosed with sexually shared infection?
No.
Okay, and Ashley, do you aware of the procedure for which you are going through today?
Yes. I was told that it's going to be a loop cut surgery and they are going to take out some sample from the neck of the womb.
Okay, and do you also aware of your last cervical biopsy result? Am I right?
Yes, there was some abnormality, and that is why I am scheduled for this procedure.
Okay, and Ashley, how many have you ever been pregnant before?
No.
Okay, I mean you don't have any babies. Am I right?
Yes, no babies.
Okay, and do you have any medical condition for which you are visiting your GP, like high blood sugar, high blood pressure, and asthma, epilepsy?
No.
Okay, and any family history of concern like blood clot formation in the legs and high blood sugar, high blood pressure, and the cancer of neck of the womb, ovaries,
So
breast?
we ask two at one go. Don't ask 4, 5
Yes.
cancers. Okay.
Okay,
No history of cancer.
okay. And do you have any allergy to drugs?
No.
Okay, any allergy to copper or nickel?
No.
Any surgeries on the tummy and down below?
No.
Okay, and I can see your weight to height ratio is 24 and it is normal. Okay, what is your blood group?
A positive.
Any reservation of blood transfusion?
No.
Okay, can I ask some personal question?
Yes.
Do you smoke?
Yes, I do.
Okay, and how many per day?
How many cigarettes? 5 to 6 in a day.
Okay, Ashna. Actually, I want to inform you, the cigarette has the negative impact on our health. Even this is not good for your this condition. So I suggest you to quit the smoking, and for that, I would like to connect you to the NHS Stop Smoking program. How does are you agree?
Okay, fine.
Okay, and do you drink alcohol?
Occasionally.
Okay, and any drug for recreation?
No.
What do you do for a living?
I'm an engineer
And with whom do you live?
with my partner.
And how is the sport at home?
Yes, he's very supportive.
Okay. And do you feel any time low mood and depressed last month?
No, not really, but today I'm very much concerned.
Okay, actually, definitely we will help you and support you. Okay. And do you want to add anything?
No.
Okay. Okay, Ashley, and I would like to examine you in the presence of Chevron from your general condition examination of your tummy and down below. It is okay.
Yes.
Okay, Ashley, thanks for cooperation. Now, coming back to your concern, as you came here for emergency contraception because you have unprotected sexual intercourse, and secondly, today we have a plan for the procedure on the neck of the womb. I would like to inform you there are two types of the contraception that we can use. One is oral and other is the copper coil. But the oral contraception tablets are available like Livonelli and Ella one we can use within 3 days of the unprotected sexual intercourse, and other one is the within 5 days of the unprotected sexual intercourse. And these are very effective contraception, but they prevent the release of the eggs from the ovaries. But in your case, as you are today 14 days of the menstrual cycle, so egg already has been released from the ovaries. Am I clear so far?
Okay, so is there anything else which can
Yes.
be effective?
Yes, yes, Ashley. Only now we can use the copper coil, and this is a plastic shape. Is a plastic shape, and we can put in the womb through the neck of the womb, and it is very effective contraception. And 99 out of 100% women it's successful, and it is worked because it release the copper, and copper is very toxic to the sperm and eggs, and even this sperm and eggs even meet with each other and egg is fertilized. This copper coil prevents the fertilized egg to attach at the wall of the womb. Am I clear so far?
Yes, okay.
And one important benefit is we can even use after the release of the egg within 5 days, release of the egg from the ovaries. Okay.
Mm-hmm. Okay.
Ashley, we during the insertion, there is some risk of the infection and bleeding and maybe injury of the neck of the womb, but generally it is a safe procedure. And but after the insertion, there are some precautions because 1 in 20% of the women it can fall out, and there is a risk of the infection. So we can give you antibiotics in high risk cases, and because there is 1% chances of the pregnancy after this copper coil. If you miss the periods, we will advise you do the pregnancy test.
Mm-hmm.
Okay.
Yes.
Okay, Ashley, now regarding your procedure, today we do this procedure, and also we will put the copper coil, and we will do this same setting. First of all, we will do the procedure, and after this we will insert the copper coil, because if we will put the copper coil first and then we will do the procedure, and in this case we can burn the thread, and the thread might be short, and we misplace the copper coil, and if we will miss it, then it is difficult to remove, and we might need the ultrasound and the camera to remove this missed copper coil. Am I clear so far?
Yes, yes, okay.
Okay, and it is difficult even after the procedure on the neck to insert the coil, because the tissue will be fragile and also risk of the bleeding. But this bleeding is not more. It stop after a few days, so you no need to be worried. So Ashley, now we will do procedure first, and then we will insert the coil. Am I clear so far?
Mm-hmm.
Okay,
Okay.
and after this, we will advise you some general measures, like you will avoid the sex and use of the tampon for 4 weeks, and after that, swimming should be avoided for 2 weeks. Okay, and anytime if you feel there is a pain in the tummy and foul smelling vaginal discharge and excessive bleeding, you have to report us back immediately. I will give you contact number. Okay.
Right. Okay. Time is up. I have one question. Can you delay the procedure? Can I just have the copper coil today?
Yes, Ashley, actually, if we will delay the procedure, there is a risk maybe we delay the diagnosis and the abnormality of the treatment. So it is not suggested to delay the procedure.
All right. Okay.
Okay.
Yeah.
Okay. So I will provide you the patient information leaflet, and I will give you the number of the support group, and you can decide. It's okay.
Mm-hmm.
Do you have any question?
No. Thank you.
Thank you.
Okay. Fine. You involved your consultant also, no, in this station?
Okay.
You have to, because when I said I would like to delay the procedure, and if I'm adamant, no, then of course we cannot delay the procedure, because then the abnormality can progress and we have to treat it as soon as possible. And if she is still insisting, then yes, you will inform the consultant. Okay,
Okay.
fine.
Okay, thank you.
Welcome. So this was copper coil. She will be having copper coil because she was day 14 or day 15 of the cycle. So pills will not be effective. So overall, it was a good one. fast station. And these days, I mean, in young patients, you can just ask about the HPV vaccine also, that did you receive HPV vaccine, just in your information gathering, that's all. Because it's a very hot topic, so if you will add that in information gathering, that would be good. Okay, so you are in the gynae clinic. Hello, I am Dr. Bushra, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Ashley. I understand you're here because you're going to have a procedure on the neck of your womb. Am I right? Is there any other concern and expectation from today's meeting? She will tell you everything about the unprotected sex and a lot of informations. I can see how much worried you are. We as a team are here to help and support you. And before addressing all your concerns, is it okay if I ask you a few questions to know more about what happened exactly and then discuss the management plan and the emergency contraception with you? I shall also give the written information leaflet about your condition. Will that be okay? And I would like to tell you that I will be asking some personal and intruding questions, but they are very important. So in the very beginning, you can signpost, that's fine. Can you tell me what happened exactly, with whom, with your partner, and was it with your consent? Even if it is with her partner, ask whether it was with her consent. Any other episode of unprotected sex in this cycle? And may I know, do you have any other partner? And may I know when was the last period? What day of the cycle are you today? So 14 or 15 day. And how are your periods? Are they regular? Any history of sexually shed infection in the past? Any abnormal vaginal discharge? Any tummy pain? And you are asking pain below the tummy, something like that. So just ask tummy pain, that's fine. Or pain down below, okay. Down below is your vagina and tummy pain is fine. Or you can ask in your lower tummy, even that is okay. Are you aware of the procedure you're going to have? Okay, and may I see your notes to get more idea? And are you aware that it is because of some abnormality in the neck of the womb? All right. And may I know how was your previous cervical screening? How were the results? Are you updated with the HPV vaccine? May I know, have you been pregnant before? And what about your future pregnancy plans? Are you following GP for any medical condition? And are you on any medication? Do you have any allergy to food, drug, or metal, particularly allergy to copper? Any surgery on your tummy or down below? Any family history of concern? Okay, just ask few questions. Cancer cervix usually does not run in the family. Okay, cancer of ovary, cancer of cervix. And may I know what you do for living? Whom do you live with? Is your partner supportive? May I know, do you smoke cigarettes and how many? So I would like to tell you that smoking has got no health benefit and it can also have adverse effect on the cervical health or it can also affect the neck of the womb. So is it okay if I put you in touch with the Stop Smoking services? Do you drink alcohol? Pardon me to ask, any recreational drugs? And how have you been feeling lately? Thanks for these informations. Would you like to add anything important? I would like to examine you with your permission and in the presence of chaperone just to assess your general health and to get a feel of tummy and from down below. And I would like to take the swabs to rule out an infection. Will that be okay? All right. Thanks for the examination. Now coming to your concerns. Do you have any idea about the emergency contraception? So we have pills, which are of two types, and also the copper coil. Let me explain one by one. Regarding the pill, one pill is effective and used within 3 days of unprotected sex. Other one is effective and used within 5 days of unprotected sex. And both the pills are effective and used before the release of eggs. But I can see that today is the 14th day. So you might be in the process of releasing egg, or most likely you might have released the egg by now. So in your situation, the pills will not be effective in preventing pregnancy. Am I clear so far? So the safest option is the copper coil. Would you like me to explain more about it? It is a T-shaped device. You can just draw there in the exam that it is a T-shaped device and it contains copper. It is inserted into the womb through the neck of womb, and it can be placed even within 5 days of egg release. It acts in many ways. actually it releases the copper, which is toxic to the sperm, and sperm cannot survive. Even if the sperm survive and meets the egg, then fertilization does not take place. And if fertilization takes place, implantation in the womb does not occur. It is very effective in preventing pregnancy. It is effective in more than 99 out of 100 women. It can also be continuous as long-acting contraceptive for 5 to 10 years. But there are some risks during insertion. There is risk of pain. You can have some pain, so we will offer painkillers. There is risk of damage to the womb, so it will be inserted by the expert. After insertion, it can fall out, and this can happen in 1 in 20 women. And there is risk of infection in the first 3 weeks, so we can offer you the antibiotics if you're at high risk of infection. Any questions? And there is risk of failure. It is not 100% protective. There is some chance of failure in that if that happens, pregnancy can occur outside the womb, which we call as ectopic pregnancy. So we advise women to check the thread of the copper coil, particularly after the periods. And if the periods are delayed, we will advise you to do the urine pregnancy test. Any questions? So now regarding the insertion of the copper coil, what we can do, since you are also going to have the loop cut procedure, we can insert the copper coil before the procedure and then do the loop cut surgery. So here, the thread can be cut or burnt. It may become short, coil can be misplaced. And for further removal, you may need scan to check the coil and camera test to remove the coil. Another option is that we can do the procedure first and then insert the coil, but in this, there is risk of infection, risk of bleeding, which can obscure the site. Tissue will be more friable and it will be difficult to hold the lip of the cervix. And here, there is more chance that the coil can fall out. Any questions? So she asked in the exam, doctor, can you insert the coil first and reschedule or delay the procedure? Well, in that case, there is risk of delay in diagnosis and treatment of abnormality, there will be delay in diagnosis and delay in treatment of abnormality in the neck of the womb. Okay, and if she still insists, then you will say that I will also be informing my consultant and he will have a word with you regarding delaying the procedure. Also, there are some precautions which you will take after the procedure, that is, avoid sex and tampons for 4 weeks, avoid swimming and exercise for 2 weeks. Tell her about the warning signs that when you go home after the procedure, you have tummy pain or abnormal vaginal discharge or bleeding contactus. Also use condoms because it reduces the risk of sexually shared infection. So never forget condoms in these stations. Every patient, you have to talk about the condoms to reduce the risk of STI. And if you get pregnant after the procedure, suppose she asks that what will happen if I get pregnant after the procedure, that is after the late procedure, there is risk of late miscarriage. You may go into labor early, so you will be offered booking in consultant-led unit. You will be offered the scans to check the cervical length from 16 weeks at regular intervals. If any time cervical length is less than expected, you will be offered a stitch to close the cervix. All right, so I will be informing my consultant also about your case, and if you're ready, we can offer the copper coil insertion and do the procedure right away. Okay, and if she's not ready and she wants to delay, then you have to involve your consultant. Fine. And you can just tell her that I will also be writing back to the GP with your permission. In these cases where they had unprotected sex and they want emergency contraception or termination of pregnancy, just you can ask writing back to the GP with your permission. Is that okay? Fine. Good one otherwise. Well done. Okay. Next. Yes.
I can do.
Yes. Okay. All right. This is Shweta's voice. Okay.
Yes. Yes.
Good. Okay. Take your case. You have 2 slides.
Yes. Yeah, next slide, please.
Mhm.
Next.
Yeah.
Can I start?
Yes, start, please.
Previous one, please.
Yes.
Previous one.
Mhm.
Yes. Hello, I'm Dr. Sweta, one of the doctor in Gynae Clinic today. Am I talking to Mrs. Julia Robbins, 36 years old?
Yes.
How can I call you?
Call me Julia.
Julia, I understand that you are here because your GP has referred you regarding some, you have some bleeding problem and yeah, bleeding problem for a few months. Is it so?
Yes.
Okay. So, as I'm meeting you first time, I want to ask few questions to know more about you. Would that be fine for you, Julia?
Okay. Yes.
Okay. Can you tell me about your bleeding in your own word?
Yes. Actually, I have noticed that I'm having some bleeding after the sex. All it is not
Mhm.
too much. There is just like some mild bleeding and it subsides in 24 hours.
Mhm. So I can see that you had earlier also in twice in last 2 months, and also it happened on and off earlier also.
Yes.
Okay, have you taken any treatment for that?
No.
Okay, so any vaginal discharge, I can see that you have excessive vaginal
Yes.
discharge. So tell me
Yes.
about that.
Yeah, it is too much at times, but like there is no foul smell. But sometimes I have to use the panty liner.
Okay, and any treatment for that?
No,
Okay. So any bladder and any problem in your water work or any opening up your bowel?
no.
So what about your periods? When was the last one?
1 week ago.
And is it regular?
Yes.
Okay. And what about your smear?
Yes, they are normal.
Okay. So when did you last go for a smear?
Yes, that was as per my schedule, so that was okay.
Mhm.
Mm.
So Julia, may I know about do you have any pain during period?
No,
Okay. And any bleeding in between your period?
no.
Okay, so and I can see that you have been using microgynon for contraceptions, and you have been taking for 3 years. Any problem with that?
No.
Okay, so Julia, and some of my questions are personal and intrusive, but I need them. May I proceed with that?
Yes.
Okay, so any bleeding, may I know any other partner before your current partner?
No, no,
Any sexually shared infection in the past?
no.
Okay, so I can see that you have 2 children. May I know about the mode of delivery and how was the recovery?
Yes, it was normal vaginal delivery and my recovery was absolutely fine.
Mhm. So any other medical illness for which you have been visiting GP regularly, like any
No.
bleeding disorder, any clotting?
No, no.
Okay, so are you taking any medicine for any other reasons, like any aspirin, any blood thinner?
No.
Okay, any family history of concern, like any cancer and any clots, bleeding disease?
No.
Okay, do you smoke?
Yes, I do.
How many cigarettes?
Well, actually, now I'm trying to quit smoking, so it is 1 to 2 nowadays.
Okay, good. So it is good that you considered stopping smoking because it is injurious to your health. So Okay.
Yes.
So any alcohol?
No, no,
Pardon me to ask, recreational drug.
no.
So, Julia, regarding how is the support at home?
Yes, my partner is supportive.
Do you feel low down these days due to
No,
this bleeding happening again on and off?
no.
Okay. So, Julia, I need to examine you in presence of chaperone, and would that be fine for you?
Okay, but GP has already examined me, and I think like he has
Mhm.
also attached the picture. So can you just see the picture?
Yes. Yes, Julia. GP has actually given me the your picture of neck of whom I can see that. So if you reconsider that I can examine you and take some swabs from the down below if there is any discharge, would that be fine?
Yes.
Otherwise, I can
Okay.
proceed with that.
All right, you can take the swabs. Yeah.
Okay. So regarding the condition from your history and the picture given to me, it shows that you have a condition called ectropion. So are you aware of it? What is it?
No, I don't know about it.
Let me explain this to you. So ectropion is whenever anything comes from inside to out. Usually what happens that inside the neck of womb, there is a soft cell. And there are some condition or there even without reason, it can come out to the come out. And inside of the cell is soft. And when it comes out, it seems to be red in color. It is friable and it is soft and fleshy like. Whenever anything touches to it, it tends to bleed. Are you with me?
Okay, yes.
So I can, so it seems that it could be the reason behind your bleeding, what happens during the contact, sexual
Mhm.
intercourse.
Okay.
So, as I told you that it can happen even without reason, and sometimes it is during pregnancy as well. But I can see that your pregnancy test is negative, and also as you have been on microgynon, sometimes this hormone can also cause this problem, and sometimes in young girl it can happen also. And even infection can cause this problem as well. So are you with me, Julia?
Yes. Okay.
Okay, so regarding the management of this, as I told you that like it is very common condition, and it is doesn't cause much problem. Usually it subsides on its own in usually 3 to 6 months time. But as you have been taking the hormonal pills, so I suspect that this could be due to this hormone, two hormone pills. So I would offer you to change this pill to another one hormone pill. Okay.
Yes.
And we see the effect after 3 months, and we'll check you after 3 months that it has gone or not. So
Mhm.
if it remains even after changing the hormone, then in that case we'll refer you to the colposcopy clinic. Do you know what is colposcopy clinic?
Yes, yes, I've heard about it.
Okay, so in colposcopy clinic, what do? That they examine the neck of womb in the big camera called with using big camera. It is called colposcope, and they see the neck of womb, and this red cells like this red lesion ectropion. They initially they do the chemical cautery. We call it silver nitrate. This is a small. This is a chemical which they apply over the neck of womb with a with a thin stick.
Mhm.
Okay.
Yes.
And this is very this doesn't need to be numbing of neck of womb or any anesthesia is not required in that. Just sometimes it can feel little warmth or some warm sensation can happen after that. And you can go after the procedure after the 15 to 20 minutes. Okay.
Yes. Okay.
If this doesn't help, then another procedure called freezing therapy. We call it cryotherapy is done. This is also done without any numbing agent or anesthesia, and they freeze the cell to so that it destroyed. And this also is a very minor procedure, and you can go home after that. Okay. And even after that, if this doesn't help, then there are procedure called heat therapy. And in this heat therapy, numbness of neck of wound or anesthesia is required. So it can take some time, like 10 to 15 minutes. And after the procedure, you will be observed for few hours, and after that you can go home. Okay.
Right.
So even after the procedure, you can go home, and we'll follow you after 3 months to see that it has gone or not. And there are some precautions you have to take, like avoid sex and tampon for 4 weeks, and avoid also swimming for 2 weeks because it can, and avoid penetrative sex as this procedure has been done. And anytime if you feel there is excessive bleeding, any unusual discharge, fever happens, then you report to us immediately, and we'll give you the 24/7 contact number. So any other concern you have?
Okay. So after treatment, can the condition come back again?
Yes, it comes back actually. The treatment can be repeated after 6 weeks. After that.
All
Okay.
right. Yeah.
So right now I'm giving you the patient information leaflet about that, and you go through that and discuss with your partner, and then I'm giving you the follow-up appointment for 3 months, and you come back after that, and we can see again.
Okay. Fine. Thank you.
Okay.
Nicely performed task. The information gathering.
So I think, but little bit, yeah.
Yeah, but you finished on time. Actually, the last question when I asked, the bell rang that can the condition can come back again? Condition can come back again. And when you're talking about changing microgynon to POP, then just say that use condom also. It will prevent the risk of sexual infection. Yes. And in these cases, you can ask about the HPV vaccine as well. Yes, it is a clear-cut picture of your cervical ectropion, very neat and clean picture, and the edges are like very clear-cut picture. Okay. And in her, we know the risk factor, microgynon. So just these like information gathering, just add HPV vaccine and condom with every contraceptive. It will prevent the STI. Okay. Otherwise, good. Information gathering, yes, you were ruling out the bleeding disorders and whether I'm taking any blood thinning agent at all. So that history is given very nicely in the talk. You have to ask those questions to rule out postcoital bleeding and whether I'm regularly taking my pills, because there is risk of breakthrough bleeding as well. Okay. Right.
And what about examination? Actually, I told her like
Yes. You
to
can
do
offer,
local
of course.
examination.
You will offer, even if the GP has done, then you can say that I can see that GP has done your examination, but is it okay if I examine you to see if there is any new change? And at the same time, I will take the swab because swab has not been taken. So yes, you can offer examination and take the swab. They will not deduct you mark in that. But if she insists that no, don't examine me again, when GP examined, it was like I had discomfort and there was bleeding and also okay, no problem. We are not going to do anything without your wish. So I have your picture, and from all the informations which I have gathered, most likely it is cervical ectropion. Yeah. Okay. Just a minute. All right, so you are in the gynecology clinic and patient is Julia. Hello, I'm Dr. Shweta, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Julia. I understand you have been referred by a GP as you are having bleeding after sex, because it is very clearly written. So here you don't have to hesitate. She's complaining of postcoital bleeding. So yes, I can see that you're having bleeding after sex. Am I right? Is there any other concern and expectation from today's meeting? So in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions and then I may need to examine you and then discuss the management plan? Is that okay? I shall also give the written information leaflet about your condition and write back to the GP about our mutually agreed care plan. Open questions about your condition. Can you tell me more about your condition? Since when are you having the bleeding? And may I know the amount of bleeding, any tummy pain? And here itself, you can say, I would also like to, or here actually you have to ask about the postcoital bleeding. So even in the beginning, you can say that I would like to ask you some very personal and intruding questions, but they are very important. So can you tell me more about the bleeding which you're having after sex, any tummy pain, any pain during sex? I can see that you're also having excessive vaginal discharge. Can you tell me more about that? Any foul smelling? Is it foul smelling or not? Okay. And how is the color? If she describes everything, then you don't have to ask the closed questions. Any change in the weight or appetite, just to rule out any sinister change, you can ask this question. Have you taken any treatment for that? Is it affecting your quality of life and your sexual life? I'm sorry to hear about that. And did you discuss this with your partner and what did he say? Okay, so he's very understanding. That's good to know. May I know when was your last period and how are your periods otherwise? Any bleeding in between the periods? Are you updated with your cervical screening and when was it done? How was the result? And have you taken your HPV vaccine? And I can see you're taking the birth control pill Microgynon. May I know, are you taking it regularly? All right. And for how long? I can see for the last 3 years. And may I know for how long have you been with your current partner? Any other partner in the past or within 1 year? Any history of sexually shared infection? I can see you have 2 children and they were born normally. Am I right? And how old is your last child? And how was your pregnancy and delivery? How was your recovery? Are you following GP for any medical condition like bleeding disorder? Are you taking any medication like blood thinners? Any allergy? Any surgery on your tummy or down below, especially on the cervix? Any family history of concern like history of any cancer or clots? And what do you do for a living? May I know whom are you living with? Is your partner supportive? Do you feel safe and happy with your partner? Do you smoke cigarettes? So if smoking, you have to offer NHS stop smoking services. Pardon me to ask any recreational drugs. Have you been feeling low or down lately? And I can see your BMI is 24. May I know your blood group? Thanks for these informations. Would you like to add anything important? So regarding your, I would like to examine you with your permission and in the presence of chaperone just to assess your general well-being and examine your tummy to get a feel of tummy. And from down below, is it okay? So GP has already examined me. Yes, I would like to examine you and I will be very gentle and I would like to see if there is any new finding and we'll take the swab at the same time. Will that be okay? If she is ready for examination, then you can just justify why do you want to examine to see if there is any local cause of the bleeding, how is the skin, is there any raw area? And yes, do the examination to assess your cervix and the womb. And of course, taking the swabs. All right, so yes, I can see that GP has sent the picture of your cervix and from the information which I have gathered, most likely you're having a condition called cervical ectropion in medical terms. Have you heard about it? So let me explain to you. Ectropion means something that was inside is now present on the outside. And in the case of cervical ectropion, cells that are usually on the inside of the cervix are on the outside and present on the outer surface of cervix. Now, these cells are very fragile and accessible to trauma during the intercourse. And as these cells are on the outer side, so the area has become very red and raw looking and it bleeds on touch. It is a common condition and it is harmless and it is not linked to cancer. So, any questions so far? Now, what could be the causes? It can happen because of hormonal changes in pregnant women, or if women who are taking the pills which contains the two hormones. Like in your case, it could be because of the pill which you're taking. It can be because of some infection, or it can be seen in the young women. Any questions so far? So regarding the management, if women have no symptom, then we don't offer treatment because condition may resolve on its own in 3 to 6 months. And as you're taking the combined pills, microgynon, we can change it to the pill containing one hormone and review at 3 to 6 months. And also with the pill, we will advise you to use condoms because it will prevent sexually shared infection. If symptoms still persist at 3 to 6 months, we will offer treatment. The treatment aims at destroying these cells to stop them from bleeding, and this will be done at the colposcopy clinic. So would you like to know more about the treatment? Yes, I want to know more about the treatment. Okay. So before the treatment, samples from affected area may be taken and sent to the lab to exclude any infection or abnormal changes. And regarding the treatment options, we have the chemical, like it can be applied on the area from where you're having the bleeding. Then other treatment options are freezing and heating. This will be done in the colposcopy clinic. And like you very well explained, that the specialist, he will look very closely at your cervix with the help of a microscope, that is the colposcope. And throughout the procedure, you will remain awake. The chemical silver nitrate will be applied to the cervix to seal off the cells causing bleeding, and this is done without numbing the area. It is painless procedure. Then another treatment option is cryotherapy, in which a small tool is used to freeze the cells to stop bleeding. This will be also done without numbing the area. This procedure works well for women with a lot of discharge from cervical ectropion. Another procedure is done with the help of diathermy. In this, a small tool is used to apply heat to the cells causing bleeding. It burns and seals them off, and injection is given to numb the area. You may have some pain and discomfort. After the procedure, you can have some pain, bleeding, infection, and it lasts for 1 to 4 weeks, and usually it subsides on its own. After treatment, you can go home after 15 minutes, and if you have severe pain, infection, bleeding, or foul-smelling vaginal discharge, report to us immediately, and we will give the contact numbers for the same. We will advise you to avoid sex and using tampon for 4 weeks. After treatment, sometimes symptoms may not resolve completely, and any improvement may be short-lived. Talk about the risk of recurrence, that there is chance that the symptom can come back again, and if that happens, then treatment may be repeated after 6 weeks. Okay. Any questions? All right. So I will be writing back to the GP about our agreed care plan and arrange for follow-up appointment after 3 months. We'll also give you the contact numbers for clinical access. Any questions? No, thank you. So in this, you don't have to arrange appointment with your consultant or anyone. It is a simple case, so you can deal with this case. Common symptoms of cervical ectropion, we know excessive vaginal discharge. There can be pain in the pelvis or back, light bleeding or spotting in between the periods, and pain and bleeding during a pelvic examination or during intercourse. Because, of course, these lesions, they bleed on touch. This is the TOG history, and all the history I have taken from here itself. HPV vaccination, ask about that, HPV vaccination. And then they have asked to exclude the bleeding disorders, medications like anticoagulants. So just your history taking was absolutely fine. Causes of postcoital bleeding. So just have a look at this one. If it is simulated patient task, it can come as structured discussion task as well. So history, examination, and investigations, management. So any postcoital bleeding, we know we have to exclude all the pathological things first. So if, of course, we are going to take the swab If it is positive, it means most likely it is because of the infection, and refer to the gum for contact tracing as well. Cervical screening test, we are not doing it routinely. It is only done if it is overdue. Any abnormal result, colposcopy. Any clinically abnormal looking cervix, directly refer for the colposcopy. Normal cervix, but persistent postcoital bleeding or coexisting IMB, only then we are going to offer the transvaginal scan, pupil biopsy, and or hysteroscopy. So our case was a clear-cut case of your, postcoital bleeding and cervical ectropion. You just have to change the microgynon.
Excuse me, Dr. Subhana.
Yes.
Here, written before going to procedure cryotherapy and diathermy, we will do the test to rule out the infection and abnormality on the neck of the womb. So this abnormal cells mean we will do biopsy or only the
No.
cervical screening?
Generally, they don't do the biopsy. If cervical screening is overdue, then they will do that. And if needed, they will take swab. That's all.
Only cervical screening enough.
Yes. Yes.
Okay. Thank you.
Okay. We have done how many stations? 3, right? 3 more we will do. Who will come next? We have Dr. Shanti. Are you there?
Yes, ma'am.
Good. Come, please. Okay, take your 2 minutes. You have just 1 page. Take your complete 2 minutes. No hurry. Okay.
I'll start, ma'am.
Okay. Start, please.
I'm Dr. Shanti. I have read the instructions and I'm ready for the structured discussion.
All right. So what is your diagnosis?
The situation is the vulval blisters on the background. She is 9-year-old girl. So I want to keep it in mind the child sexual abuse with herpetic vulval ulcers and budget and also foreign body in my mind, and then I will progress accordingly.
Okay. And what is your initial management?
Initial management, I want to hospitalize the girl because she is 9 years with difficulty in passing the urine. So after applying lignocaine gel, I want to put a small size catheter to let out the urine and make her comfortable. After ruling out allergy, I will give paracetamol tablets, and then I will start my treatment.
Okay. So
My further management will be
Yes.
after taking proper history, examining the patient and investigating her, and then will be the management plan. So here I can see the mother can't speak English, so I sensitively will ask whether she wants any interpreter, and then at the most I will assure confidentiality, and tell that everything will be confidential between the doctor and the patient. And then I will start my history. First, in the history, I would like to ask how long these blisters were present, whether this was the first episode or she has a previous episode also, whether she has ulcer anywhere else in the back passage, in the mouth, or anywhere else. And then I would like to ask about any vaginal discharge, any abdominal pain, and then any fever, flu-like symptoms like headache. And I would also like to um, ask how long she was not able to pass urine, and when she last passed urine, whether there is a burning while passing urine, and how long those symptoms were present. And then I would like to ask the mother whether she has attained menarche. When was her, if attained menarche, when was her last periods? I would ask about then any medical history of significance, whether she is on any other drugs, whether she is following the GP for any other drugs, any drug allergy is there, and then any family history of significance is there. Here, the social history is very important. What was the status of the child, whether she is an adopted child? Here I can see the mother is very much disturbed. So I want to ask whether she is a single parent, or whether they have whether she's a divorcee, or I would like to ask whether the partner whom the mother is living, is the father of the child. And then I would sensitively ask whether who's looking after the child, like whether she's in the foster home, and how about her academic performance in the school, whether she is regularly attending the school. And then and also I would like to ask about any history of domestic violence at home, whether any other child, like a sibling, is also similarly affected. And then then I will examine the girl with the help of a nurse specialist, and then I will make the child to sit on the mother's lap in a frog-like position, and then I will ask the child to cough and see whether there is any discharge, and then if needed, I may take a photograph of any injuries. If I would like to examine the injuries and like to take a photograph if the injuries are present. And then I would like to the general examinations, like whether the child is anemic, or the pulse and the blood pressure will be measured, and the per abdomen I will see whether there is a palpable bladder is present or not, because in hepatic lesions there may be autonomic bladder may be present, so I want to rule out that. Then I want to see any the whole head to toe examinations for any bite marks or any physical injuries. And the treatment, regarding my treatment, it will be multidisciplinary. I will involve the forensic medicine and adolescent gynecologist, pediatrician, as well as social care services, if child safeguarding specialist, midwife, and the child safeguarding consultant in charge. Everyone will be involved in the care, and the child will be admitted in the pediatric department. And initially, I will give the lignocaine gel as well as seeds bath. And then if the secondary infection is present, then I would like to give antibiotics accordingly. And then the acyclovir will be started according to the pediatric dose after discussing with the pediatrician, after ruling out allergy. And then this is what the management plan is. Then regarding the investigations, I would like to take the swabs for herpes as well as for the chlamydia as well as gonorrhea, and then blood investigations for HIV, hepatitis B, syphilis, and then I will involve even the sexual health specialist. For all the sexually shared infections will be screened. And then then if she had attained menarche, then I should give even the emergency contraception as well. And then if if there is a risk of other siblings or other child to be affected similarly by sexual assault, then I should involve the police plus the child safeguarding services. I will check whether the safety of the child on reaching home. Otherwise, I will involve the social services as well. This was a management which I want to do for the girl.
Okay. And what is the long-term risk in this
Uh,
case?
These type of girls will be going for psychosexual, like they'll get flashbacks as well as post-traumatic stress disorder. So I will put in touch with a psychiatrist who will give counseling, and then they should be, even the mental illness should be treated for them.
Okay. And any support group number will you give
Yeah.
someone?
If it is proven sexual assault, then I will involve the sexual assault support groups, like rape crisis, like those support groups I will involve.
And will you inform the police?
Yes, definitely, because that if there is a, yes, definitely, if the mother wishes, and then if there is a risk for the other siblings or the other child, then I will involve the police.
Right. Okay. Few more minutes. 1 minute.
Yeah.
If anything else you want to add. And you have to discuss the case in the meeting. They have maze meetings. So,
Yes.
yeah.
Multi-agency sexual assault meetings and
Yes. Mhm. Okay. Fine. Overall, well done. Did you say that you want to see the child alone without the mother?
yeah, that I didn't say, ma'am, but I assured confidentiality in the.
You
I
have
didn't
to,
say.
yeah,
Yeah.
you have to say that. It is very clearly written in the talk that
Okay.
we have to say, and if the mother is not convinced that why do you want to see my child alone, then what the talk says that you have to tell her that this is a normal thing which we do in the clinic. We see the
And then
patient
I have
alone
to say
once.
my own words what happened, that I
Yes.
should ask.
Yes,
Yeah.
yes, yes. And we have to believe the child, whatever she says. Very
Yes.
important patient safety. We have to see the child once alone. Even in domestic violence cases, we will see once. So even if the partner isn't interfering, that why do you want to see my wife alone? So we have to convince him that this is a norm. This is something which we do, which is very normal in our clinic. We see the patient alone once. This very nice line is given in the talk. That is why we have included that answer here, that we have to see the child alone without the mother. Any suspected case, anything. Like as a gynecologist, what the talk says that it is very difficult for a gynecologist to find out whether the child or the adult is a victim of sexual abuse. So if there is any suspicion, even it is 0.1% suspicion, I will inform my senior and we will try to see the concerned
Child.
person alone. Yes, yes.
And
Yes.
then I didn't say about the examination under anesthesia also, because she's 9 years old.
Yes, so if she's reluctant for examination, yes, we are not going to do anything forcefully. We have to examine under anesthesia. And what else? Yes, I was waiting for you to say that she can't speak English, and then you told that yes, I will I will see to it. So good. And no doctor in structured discussion task. Again, you started with Dr. Shanti, right?
Yes, ma'am.
Yes.
I thought I couldn't control myself. I said like.
So the good idea is that we should also address
Practice.
each other with the names. You call me Shabana, I will call you Shanti. We will call each other like Anita, Shweta, Bushra. So that's okay. No formalities. You people are free to call me Shabana. Because if you will call me ma'am, Dr. Shabana, that thing will never come out in the exam. It happens. So it's okay. No doctor in our sessions. Fine. It will be our names. Good. Otherwise, okay, fine. But there are important points. which
Okay,
you
Miss.
are not supposed to miss, my dear. No, that is very, very important. All right, so hello, I am Shanti and I'm ready for the discussion. So what is your diagnosis? Whatever you are going to say, whatever is your diagnosis, justify that you why you have diagnosed this condition. Okay. All right. So most likely diagnosis is child sexual abuse and herpes simplex virus infection because the child is in severe pain. She's having painful blisters. She's having difficulty in passing urine. Also, she did not show any resistance to genital examination. And other differential diagnoses are UTI, vulvovaginitis, and foreign body. So what is your initial management? So yes, I will first introduce myself with my name and role to the mother and child, arrange a professional interpreter. In the very beginning, you can say when you are starting your initial management, arrange a professional interpreter because I can see that the mother can't speak English. And I will address any emergency first, will confirm the child's name and age. This will help in building rapport with the child. As I am suspecting child sexual abuse, I will also involve my consultant, child safeguarding nurse, and will follow the child safeguarding protocol. I will involve the specialist in managing child sexual abuse and the pediatric gynecologist. And regarding the treatment, as the child is in pain, I will offer analgesic after ruling out allergy. She is having difficulty in passing urine. So we'll catheterize gently using aseptic technique and use lot of local anesthetic gel and small indwelling Foley's catheter that is size 12 French. Then, like I have to explain and pacify the child so that she is not unduly frightened. What is your further management? So I have to take the detailed history very sensitively and see the child alone with chaperone without a mother, as child may be afraid of relieving or disclosing important facts in front of her mother. Asterix, patient safety. Professional interpreter, asterix, patient safety. MDT, patient safety, communication with colleague. Every red thing and asterix, very important points. And regarding the history, I will believe the child, whatever she says, okay? And I will ask the mother whether she's also aware of or suspecting child sexual abuse. I would like to know whether child is having other symptoms like fever, abdominal pain, vaginal discharge or bleeding. How about the bowel opening? Would like to know the details of incidents, when, where, how, by whom, and the nature of event. Any suspect or culprit is known to them. Whether child was given alcohol or drug. Any previous such episode, if so, how many? Regarding the menstrual history, I would like to know whether the child has started menstruating and when was the last period, because there is risk of pregnancy. I would like to know whether the child has any medical comorbidity, whether she is taking any medication, whether she has any allergy, because we have to give her medications, whether she had any surgery on her abdomen or pelvis, and regarding the family, I would like to know the support at home. If other siblings are at risk of sexual abuse, how is the financial support, whether she's an adopted child, and also how is the relationship between the mother and her partner. And like few things what they have mentioned in the NHS side, that we should also know whether, okay, adopted child, and whether like she is the stepmother or like the father is the stepfather. Regarding the school, I would like to know about her peer group and how's the studies going on. And then examination, initially it will be with her mother's permission and in the presence of chaperone, done by the specialist or physician in the childhood sexual abuse evaluation. It's going to be head-to-toe examination. I will assess for any bruise, ask the nurse to check the child's observations. If it is given, then you don't have to mention. If not, then you are going to mention everything: blood pressure, pulse, temperature, respiratory rate, weight, height, and BMI. Assess for the secondary sexual characteristics, breast development, axillary, and pubic hair. Then come to the abdominal examination to check for any tenderness, abdominal mass or marks of physical abuse. Vaginal examination, first inspection to check for the condition of skin, genitalia, vagina. If there is any hymenal tears, then speculum examination very gently with vaginal speculum or otoscope, rhinoscope, or vaginoscope. Photographs will be taken by the experts with the permission of mother. For the examination, frog's leg position can be attained, or like she can sit in her mother's lap. Ask the child to cough to see if there is any leak, vaginal discharge, or any foreign body. If the child is resistant or very afraid, then we will offer examination under anesthesia, but I'm not going to force the child for any examination. Investigations, pregnancy test is very, very important. Then the blood test, full blood count, check for hemoglobin, white cell count for infection, and liver function and kidney function test if needed. Screen for STIs, HIV, hepatitis B, HCV, syphilis. Usually it will be negative initially, and if negative, when are we going to repeat? Remember this time frame after 3 months. And screening for chlamydia and gonorrhea, if negative, repeat after 3 weeks. So it is 3 months and 3 weeks. Swabs for STI, including for herpes simplex virus. And for that, like, we also have to refer the patient to the sexual health clinic to rule out any other STIs. Urine test, it will be MSU and culture sensitivity, and sample will be taken from the catheter. Further management of her admission in pediatric ward, and she will be taken care of by the MDT, including the gynae consultant, pediatric gynecologist, sexual health specialist, psychologist, counselors, and specialist nurse. We will also contact with the school and social services. Medications, so symptomatic relief, we will for symptomatic relief offer analgesics like paracetamol, saline bath, lidocaine, acyclovir after discussion with the pediatric consultant. Give the support group number to mother, the MOSAC. Even if you will remember the short form, it will give you bonus in the exam. That is mother of sexually abused child. Discuss the case in the meeting, the MAZE meeting. If you remember the short form, even that is fine. That is the multi-agency child exploitation meeting. So how to remember? MO is mother and MO MOSAC. So just remember MO. Support group for mother is MO, mother and MOSAC. And MAZE is the meeting. We have to discuss this case in the meeting, the MAZE meeting. Social services to find out if other siblings are at risk of sexual exploitation or not. And I will inform the police if sexual abuse is confirmed, and also if other siblings are at risk of sexual abuse. As the child has gone through a lot at this tender age, I would like to refer the child to the counselors, provide her with the psychological support, rule out psychological issues like post-traumatic stress disorder and flashbacks. Regarding the discharge, we'll discharge after adequate treatment and only when it is confirmed that child is safe and the environment where she is going is safe, and we have to involve the child safeguarding services. So this is how I'm going to manage the case. Okay. All right. We have Maria. Are you there today?
Yes, I'm here.
Good. Okay. I will not call anyone doctor now, and you people also don't call me doctor and madam, call me Shabana. Then only it will be like we will not call us doctors in the structured discussion. Otherwise, what we practice, it comes out from our mouth. Okay, take your 2 minutes. You have this, just one slide, okay.
Okay, I'm ready. Hello, I'm Dr. Maria, one of in the gynae clinic today. May I confirm your name and age, please?
Yes, I'm Jessie Simpson. I'm 15-year-old.
How may I address you?
Call me Jessie.
Okay. Jessie, I understand you are here as you had an unprotected sexual intercourse and you want to discuss about the emergency contraception. Is it so?
Yes, what happened? I was with my boyfriend, and we had sexual intercourse, and my boyfriend he just forgot to use the condom.
Okay, I see. So, JC, in a moment, I'm going to address your concern. But before this, I would like to ask you questions to know more about what happened exactly. And then we will discuss in detail about the emergency contraceptions. Will that be okay?
Yes.
Okay, so JC, can you tell me what happened exactly?
Yes, actually, yes. What happened 2 days ago? I was with my boyfriend, and it was a late night party, and we just had this like casual sex.
Okay, so was it with your consent?
Yes.
Okay, so may I know for how long have you been with him? I mean, with this relationship?
Yeah, for the last 1 year.
Okay. May I know age of your boyfriend?
Yes, he's 18-year-old.
All right. Yeah, JC, one thing I would like to tell you here that today, whatever we will discuss, it will remain confidential. So feel free to tell each and everything easily, okay? Whatever you
Yes.
want to tell, discuss it, okay?
Yeah.
So JC, just I want to know that do you have any abnormal vaginal discharge?
No,
Okay. Do you have any pain during sex?
no.
All right. When was your last period?
10 days ago.
Are your cycles regular?
Yes.
Are you using any form of contraception?
No, not really. My partner is using condoms, but on and off.
All right. Did you have any other episode of intercourse in this cycle?
No.
Okay. Are you updated for cervical screening?
Mm. What is that? I don't know.
All right. I will let you know about it later on. Can you tell me that have you ever been pregnant?
No.
Okay. Are you calling your GP for any medical condition? I can see in your notes that you are known case of epilepsy and you are taking for it lamotrigine.
Yes.
So is there another problem also? Is your epilepsy is a control with this medication?
Yes, I think so, because my doctor was saying that everything is fine as of now.
All right. Any other medical problem like migraine or history of headache like this?
No, no.
Okay. Is there any history of past surgery? I mean, surgery of tummy or down below?
No.
Okay. Do you smoke cigarette?
I do. Yes.
How many cigarettes do you smoke daily?
Yes, 2 to 3. Sometimes it is 5 to 6 in a day.
Okay. So, do you drink alcohol?
Occasionally.
And what about recreational drug? Pardon me for asking it.
No, no.
Okay. So, what are your thoughts about smoking and alcohol?
Well, what should I do?
Have you ever tried to quit it?
No, not really.
Okay, JC, as you know that these both things are not good for health. If you wish, we can connect you to stop smoking and stop alcohol services. Okay, these services are really going to help you a lot. Okay.
Yes. Okay.
Okay, so may I know whom do you live?
With my parents.
Do your parents know about your boyfriend?
No, they don't know. And please don't tell them about my boyfriend.
I do respect your wishes about JC about it, but I would like to encourage you. Why don't you want to inform your parents?
Oh, they will be very angry with me. I have not told them anything. And at the moment, I don't want to know them anything about me and my relationship.
Okay. Okay, JC, have you been feeling down and depressed for a couple of weeks?
No, not really.
Okay. Are you aware about your weight height ratio?
24.
Okay, so it means you are having a normal weight height ratio. JC, I would like to perform an examination with your permission in presence of Chevron. I would like to assess your general condition. And I would like to do a tummy examination in down below. Will that be okay with you?
Okay, yes.
Okay, so JC, coming to your concern, you want emergency contraception. Do you have any idea about
No.
emergency contraception?
No.
Okay, let me explain. JC, there are the different types of the emergency contraception. Some are in forms and some are coil form. So in pill forms, yes, there are the Levonorm and also there is the Elavon. Okay, these both are the pills we take by mouth, and the Levonorm is taken within a 72 hours of the intercourse, while Elavon can be taken within a 5 days. Okay, both are very effective, but still there are the chances that patient may get pregnant. Okay. I would like to know, when was your last period?
Yes, 10 days ago.
10 days ago. So you can go for this option also. You can have a pills because these pills inhibit the egg release. Okay. So it is important to take before the releasing of the egg. So as you had a period 10 days back, so this option you can opt. Okay. And there's another also option that is the coil. Copper coil, basically it is a T-shaped device and it contains the copper. And this copper basically is very toxic to the sperm, and also it inhibits the fertilization process as well as it inhibits the, implantation process, right?
Yeah,
Then
but
we also,
you said it will be inserted inside my womb, right?
yeah,
I don't want anything in my womb. No, it will be very painful. So what about the pills? I'm ready with the pills. So will it interfere with my epilepsy?
yeah, you can go for the pills, but problem is this, that you are currently taking lamotrigine for epilepsy.
Yeah.
So the combined pills will not be a good option for you. You can have a progesterone only pill, okay? Because this combined pill contains the estrogen and it decreases the efficacy of the lamotrigine. So as a result, you may have a increased frequency of this, okay?
But I
So
can take any of the contraceptive pills, isn't it? I mean, emergency contraception.
yeah, you for emergency contraception, yes, you can have a Levonorm as well as also you can have a Elavon.
All right.
Yeah.
Okay. Any side effects with these emergency contraceptives?
Yeah, problem with these contraception is that you may have a nausea or vomiting. In case if you are vomiting, then you need to repeat the dose. Okay. So, or otherwise you can come to us and then of course we will advise you another contraception method.
Okay, right.
Okay, JC. Okay, so JC, there are some other also long-acting reversible contraception methods. Okay, I would like to offer you that in future you must go for it. There are the coil method, copper ICD, and also hormone method. I mean Mirena, and also some injectable methods and implant. Okay, which remain in the skin for 3 years, right?
Yeah.
If you want, I can give you more information regarding it. Would you like to know more about it?
No, not as of now. And tell me to use condoms as well. Don't forget the condoms.
Yes. Yes.
Okay, good.
So Jesse, these are the information leaflets, and these are really going to help you to know more about emergency contraception. And these are the contact numbers. If you are having any problem, you can make a contact with us. And I'm really sorry, I didn't see your age. You are currently 15 years, so you are not candidate for cervical screening.
Yes.
Okay.
Yeah.
So, thank you so
Okay.
much.
Thank you. Time is also up. And overall, very nice. I mean, all of you are taking history very nicely. Nice voice, nice tone. No one is rushing. Even you were also taking very nice history. She's 15-year-old. Just in between, you can say, am I making sense? Are you able to understand what I'm saying? Would you like me to repeat anything? Because you have to assess her mental health. Now, we indirectly. So just in the exam, if such young teenager is sitting in front of you, so you, of course, in the exam, 15-year-old role player is never there. They will be big role plays, but the age is 15 years. So yes, you have to just ask that, would you like me to repeat anything? So do you know the name of the pills? Can you repeat? One is the Levanil and one is the 11. So do you know, like, just ask that, are you able to understand? Like, when are you going to take the pills? And if you have vomiting, then you have to repeat the dose. You know that. All right. Confidentiality in the very beginning, you will say. So I was waiting for this word confidentiality. And yes, you did say when you were started to take the history. Otherwise, what happens sometimes that when you will ask them, can you tell me more about what happened? They will not say anything. They will just keep mum. So then you have to see, okay, my God, she's 15 years old. So, okay, what's her name? Okay, Jessie, I would like to assure you the confidentiality, and whatever you're going to tell me will remain confidential. Then she will open up. Okay, so teenager girls offer confidentiality in the very beginning. Right. So,
Right.
hello. Yeah. Hello, I'm Dr. Maria, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Jessie. I understand. Oh, yes, you can ask about the school also, either here or when you are occupational history. Usually when we say that what do you do for a living? So here you can say, I can see that you are 15 years old and do you go to school? So either in the beginning or somewhere in the history. Okay, so I will start here in the beginning. So Maria, sorry, not Maria, sorry, she's Jessie. Okay, so Jessie, how are you? And how is studies going on and how are things at school? I understand you had unprotected sex and you want to discuss about the emergency contraception, am I right? So at the very outset, I would like to tell you that whatever we are going to discuss will remain confidential and I'm not going to disclose this to anyone without your permission. Is that okay? So is there any other concern and expectation from today's meeting? I'll discuss, I can see how much worried and concerned you are, and in a moment, I'll discuss with you about all the emergency contraceptive methods. I will also give the written information, a leaflet regarding that. Okay, so I would like to ask you some personal and intruding questions as well, but they are very important. Can you tell me exactly in your own words what happened? And okay, so she will tell you, I had sex last night in a party, forgot to use the condoms. And otherwise, are you using the condoms regularly? No, just on and off. And was it with someone you knew? Was it with your consent? Since how long have you been together? May I know your partner's age? And I would like to know, were you with someone before him? Apart from last night's episode, any unprotected sex during this cycle? May I know when was your last period and how are your periods? Are they regular? Any history of sexually shed infection? Any abnormal vaginal discharge? And are you using any birth control methods? Okay, only condoms on and off. Have you ever been pregnant before? Very good. You asked this history. Many of my candidates and colleagues, they just skipped this history. No, you have to ask. Any sexually active girl, whether she's a teenager or whatever, you have to ask about the ops history. And I can see from the notes that you are having a medical condition known as epilepsy. Am I right? And are you following up with your epilepsy doctor? Do you have any other condition like asthma and migraine? And how is your epilepsy? Is it well controlled? I can see you're taking the medication lamotrigine. Are you taking it regularly? Any allergy to food, drug, or metal? Okay, and may I know any surgery on your tummy or down below? Whom are you living with? Okay, with my parents. So how is the support at home? May I know, have you informed your parents about your boyfriend and your sexual relationships? No, so she will say no, please don't inform. Yes, I'm not going to inform your parents about your boyfriend, but at the same time, I would like to encourage you to inform them. No, she's very much afraid. So, okay, I respect your wishes. May I know, do you smoke cigarettes or drink alcohol? So I would like to tell you that smoking and alcohol, they have got no health benefits. And if you wish, we can put you in touch with our stop smoking and stop alcohol services. Will that be okay? Pardon me to ask, any recreational drugs? And may I know, how have you been feeling lately? Have you been feeling lower down? Okay, I'm a little worried about after the sex. Yes, I can see that you're worried, and in a moment I'll be discussing about the contraceptive methods. Thanks for these informations. Would you like to add anything important? And is it okay if I examine you with your permission and in the presence of chaperone to assess your general health and to get a feel of tummy and from down below and take the swab at the same time? Will that be okay? So you have already encouraged to inform the parents, so no need to repeat. Go to the tree management, all right? So regarding the emergency contraceptions, do you have any idea? Let me explain to you. We have the pills and the copper coil. Pill is taken by the mouth, and the copper coil is a T-shaped device which is inserted inside the womb. Do you have any preferences? No, I don't want anything inside the womb. I prefer to have the pills. So can you tell me more about the pills? Yes, we have two types of pills. One is Livonel, which is taken within 72 hours of sex, and Elavon, which is taken 120 hours, that is within 5 days of sex. And both are effective, but more effective the earlier you take them. I will like to tell them that they are not 100% effective. There is still some chance that pregnancy can happen, and they both generally work in the same way. Am I clear so far? Would you like me to repeat anything? So would you like to know how they work and how they prevent the pregnancy? So what they do, that they delay the release of egg from the ovary. And when eggs are released, then there is no sperm inside the womb. So they decrease the chance of getting pregnant. Am I clear so far? Any questions? These medications can have side effects, like you can have nausea and vomiting. And if you vomit within 2 hours of taking Livonel, visit us again so that we can repeat the dose. If you vomit within 3 hours of taking Elavon, then again, the dose needs to be repeated. The periods can also be early or late or sometimes heavy. And if the periods are late, then we will advise you to do the pregnancy test to check whether it is positive or not. Any questions so far? So may I know which option do you prefer? All right, so which pill, if she wants Elavon or whatever, okay, I will write a prescription for you and you can take it right away. And after that, keep an eye on the periods. And what will you do if your periods are delayed? Yes, you have to do the pregnancy test. And what will you do if you have vomiting within 3 hours? Yes, you have to come to repeat the dose. So take care of that. Am I making sense? Is there anything which you want me to repeat again? Am I clear? Okay, fine. I would also like to advise you about the future contraception. Use effective contraception to avoid any unplanned pregnancy. And you can discuss this with your GP, or like we also have the family planning clinics. So you can use the injections or the copper coil or the Mirena coil. Or like you can take the pills along with the condoms, but with the pills containing the estrogen, it can decrease the efficacy of the medication lamotrigine and increase the risk of seizures. Again, I would like to encourage you to inform your parents about your relationship with your boyfriend. Okay, any questions? So I will give the written information leaflet, contact numbers, and if you have any concerns, visit your GP or contact us anytime, and we would be happy to help you. Any more questions? Are you clear about your options? Okay, thank you. So scenario can be little bit like it can change in the exam. I'm coming to this line first. If BMI is more than 26, weight is more than 70, or she's on enzyme inducers, then yes, we can double the dose of levonorgestrel. But we cannot double the dose of ulipristal, isn't it? So if BMI is more than 30, weight more than 85, or enzyme inducers, ulipristal will not be effective. So in these cases, we are going to give levonorgestrel 3 milligram. If you have to write the prescription, usually like for the last 5 years, no one told me that prescription writing was in the exam. But suppose there is prescription writing, then you are going to write the name, date of birth, and HS number, and the tab ulipristal acetate, 30 milligram, 1 dose, levonorgestrel, 1.5 milligram, 1 dose OD. Success rate, we know copper T is the most effective emergency contraception. Success rate is more than 99%, that is more than 99 in 100. Ulipristal acetate success rate 97 in 100 and levonorgestrel 95 in 100. Then for ulipristal acetate, we have to rule out if she is having severe uncontrolled asthma or glucocorticoids. It is a contraindication. Proton pump inhibitors, omeprazole. So yes, many of you were asking whether you are on antacids and all those. Very nice history. Enzyme inducers, any medication, you have to see the enzyme inducers. So can anyone tell me the name of few enzyme inducers in epilepsy?
Carbamazepine,
Yes, carbamazepine,
phenytoin,
phenytoin.
and oxcarbamazepine also.
Yes, fine. And non-enzyme inducers?
Sodium valproic acid
Yes, sodium valproate and
Lamotrigine, yes.
lamotrigine.
lamotrigine, yes, and levetiracetam.
Okay, and yeah, gabapentin. These are all non-enzyme inducers. So lamotrigine, of course, if she wants to say, if can I use the pills in the future, the contraceptive pills, then you have to counsel that this estrogen can decrease the efficacy of lamotrigine and increase the risk of the seizures. Okay. All right. So last exam, I think there was structured discussion where the patient had epilepsy and she was on lamotrigine. So it was structured discussion task. So history, examination, everything will be same. And for the long term, she was on day 14. So if day 14, it will be the copper coil for her, the emergency contraception. She can use it for the long term also. And she wanted other long-term contraceptives. So it will be injection Dimpa or Mirena, but no implant. Implant is UKMEC2 for these epileptic patients. Injection Dimpa, what the guidelines says that it also decreases the risk of seizures. Okay. Last question, who will come? Okay, few points here, few points. Adult, we know it is 18 years of age, consent for sex. From 16 years onwards, they can give, isn't it? Sex is considered unlawful from 13 to less than 16 years. And if it is less than 13, even if it is with the consent of the girl, it is considered as rape. Age gap with a partner, very important question, which you are going to ask in these scenarios. May I know your partner's age? Gap up to 4 years, no need to worry. Gap is more than 4 years, safeguarding team. If she said my partner was 20 years, 22 years, then yes, you have to involve the safeguarding team. And in these scenarios, you're going to ask that is your partner giving you some gifts like mobile, laptops, like maybe he's alluring her for sex. Like this is just give and take relationship. That is why. So you have to ask those questions in the history. All right. Last, someone has to volunteer.
Ma'am, I can do. Anita.
Yes, Anita, come please.
Uh,
But you
so
have to
Dr.
speak.
Shabana for sorry, Dr. Shabana,
Yes.
for Ulipristal and the Livonel, we can give with lamotrigine. It will not
Yes.
affect.
It will not affect. Yes, you can give. No, no.
Or any
Yes,
enzyme inducer.
yes. Ulipristal you can give because it is not an enzyme inducer. But with enzyme
But if enzyme
inducer,
inducer will not give Ulipristal
exactly.
and increase dose of Livonel.
Yes,
Okay.
exactly. Yes. All right, Anita, take you 2 minutes, okay?
Okay, ma'am. Yeah, ma'am. I can
Ready?
start, ma'am.
Okay, start please.
Hello, I'm Dr. Anita, one of the doctor in the gynae clinic. May I know your name and age, please?
Yes, I'm Mrs. Dana Brown, 30 years old.
Yeah, so how may I call you?
Call me Diana.
Okay, Diana, I can see, first of all, I'm very sorry as you had to wait for such a long time as the clinic is running late, and we'll try to make it next time. You don't have to wait, okay?
Oh, all right. So, yes, because my time is very precious, and please see to it that it will not happen again.
Yeah, definitely we'll make it out. The next time you don't have to face such situation. Okay.
Yes. Okay.
So, Diana, I can see the GP has referred you as you wanted to undergo sterilization, right?
Yes.
Okay, so definitely today we'll be discussing about what sterilization means and also like how to go ahead with that. But any other concern apart from this?
No, no.
Okay, so can I ask you a few questions?
Yes.
Okay, so Dinah, can you tell me why is it like you want sterilization?
Yes, actually, I'm a very busy businesswoman, and most of the time I am away on trips. And I already have 2 children. I think my family is complete. And like sometimes I don't even have, I'm not able to give time to my children. So even my partner is a very busy person. That is why I want to have sterilization.
Okay, okay, so can you tell me about your periods, your cycles?
Yeah, periods are okay. The last one was, I think, 10 days ago.
Okay, till now, are you using any contraception?
Yes, actually, I used to take these pills, but I forgot to take, sometimes I used to forget. And so now I stopped taking the pills as well. And my partner is using condoms.
Okay, any unprotected intercourse this time?
No,
This
no,
cycle?
no.
Okay. Well, how about your your smears? Are they updated?
Yes.
Okay. And what about are you with a regular partner?
Yes.
Okay. Anytime you or your partner had any sexually shared infections?
No,
Okay. Any abnormal discharge you have noticed?
no.
Okay. as you told me, you had previous two child from by cesarean section. So how was the delivery and how was the recovery?
Yes, delivery was okay. In fact, like I had some bleeding after the cesarean, but it was okay. In fact, like I don't want to have any more cesarean. Enough, two were enough.
Okay. Okay. Well, how about any medical conditions you're having?
No, nothing.
Okay. Any medications you're taking?
No,
Specific?
no.
Okay. Apart from cesarean section, any other surgeries?
No.
Okay. What about your partner support? How is it at home? Everything fine?
Yeah, he's okay, but most of the time he's away.
Okay, I see. So how have you been doing last few days or months? Everything is going fine?
Yes.
Okay. So, Diana, anything else you would like me to know?
No.
Well, thank you so much for your information. Diana, I'll just have a quick examination. I have I've already, the BP blood pressure is okay, and I've also been provided with your weight and height ratio. I'll
Mm-hmm.
just check on your tummy to see the scars, and also from down below to see if any abnormal discharge is there, so that if it is there, we can send some swabs for the infection. Okay.
Right, yeah.
Okay. So coming to to your concern regarding the sterilization process, are you aware of what actually it is?
I have read a lot about it. I know that you will just do some keyhole surgery, apply some clips, and that's it, isn't it? It's a very
Yeah,
simple
very right.
procedure. That's what I know. It doesn't take much time also.
Yeah, very right, Diana. Actually, it is a permanent method of sterilization, where what we do is we generally either clip it or we put some rings on the tube, or sometimes we may even need to cut and tie the tubes, okay?
Yes.
And generally, this is done by a keyhole process, where after taking proper consent, proper consent, and also getting you connected with the sleep doctor, it will be done after putting you to sleep. Okay.
Mm-hmm. Yes.
Okay. This keyhole process is generally a safe process in expert hand, but it has its own risk and complications. And in your case, as you had previous to cesarean, the complication rate may be a bit higher. Okay,
Mm-hmm.
am I clear?
Okay.
Uh, So generally what involves is as you had two cesarean sections, so sometimes we may have even difficulty getting inside the tummy with the keyhole, and we may have to sometimes convert it to open process also, right?
Okay. Yes.
And also, like once we are inside the tummy, there may be increased chances of injury to the bowel, bladder, or any other organs. And sometimes we may not even be able to find the tubes because of the previous scars and adhesions.
Mm-hmm. Okay.
Okay. In such situation, we may have to give up the process also.
I see.
Right.
Okay.
Also, we have some chances of infection, bleeding, or wound sometimes infection, bleeding, or pain after following the surgery,
Mm-hmm.
right? And as such, it is a very safe process, but it is also not 100%. And sometimes there are chances of failure, which is around 5 in 100 or something. And in case the in if 5 in 100, and some if in by chance you conceive even after the ligation, which happens very rarely, then in that case ectopic pregnancies are very highly likely.
Yes.
And do you know about ectopic pregnancy?
Yes, I know a little bit.
Yeah, these are pregnancy which are not inside the womb, but generally in the tubes. Okay.
Mm-hmm.
Now, many people, as you are very young, Dinah, at this such young age, many female women do have regret in future after having ligation done, maybe because of like some changes in the personal life, like new partners, or even like the child may get sick sometimes. So in such situation, they demand sometimes reversal of sterilization, that is to put back the tubes together. Okay.
Mm-hmm.
But taking that concern, reversal of sterilization is again it's a major surgery, and also it is not funded by the NHS.
Okay, I see. Mhm.
And the success rate is around 1500. And also, if it's successful, again, in this case also, the chances of having pregnancy in the tubes are more.
Mhm. Okay.
Am I clear?
Yes.
So, Diana, apart from sterilization, which is a very good method, there are other methods, effective method, which is quite similar to sterilization. The efficacy is quite similar to sterilization. Like you may have some long-term contraceptive methods like the copper coils. You may have some hormonal coils, which we call it Mirena, and also some implant and injections.
Mhm.
If you like, we can discuss about that also.
Okay, so no, not as of now. But will they be effective in preventing pregnancy?
Yeah, definitely. They are quite effective and almost well to sterilization. And anytime, next time you want pregnancy, you can even take it out at your own wish. Okay.
Mm-hmm. Yes. All right.
Hello.
Yes. Okay. Yes.
Okay. Also, we have a method which is known as male sterilization,
Mm-hmm.
which is known as vasectomy. So, in that process, generally, it is for the male, and it is much safer and much quicker compared to the female process. And you can even talk to your partner regarding that. And the efficacy is much higher than the sterilization process.
All right.
Will you like to know about it?
Well, no, not as of now. Let me think about all these options. Okay.
Okay, so I'll write back. I'll provide you with the patient information leaflet, and I'll also write back to the GP whatever you've discussed. If you want to go ahead with sterilization, we'll definitely put up another appointment later on, and we can sign up the consent form and go ahead. Okay.
Yes. Okay.
Okay.
Thank you.
Thank you so much.
Okay. Good one. Just 30 seconds remaining. Very nicely done task. I mean, there is nice flow and very good pace. Good. Well done. All of you, well done. I mean, I can make out you people are practicing and communicating a lot because such nice flow will never come without practice. Well done. Good. You apologized in the beginning. Very good. If you will not apologize in the exam, this role play will interrupt you so much that you will feel like running away from that station. Okay, good. Because she was a very high-headed lady, businesswoman. So if you will not apologize, she will keep interrupting a lot. Good, you apologized first. Okay, so you are Anita, right? Hello, I am Dr. Anita, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Okay, thank you, Diana. First of all, I would like to apologize because I can see that you have been waiting for 40 minutes. I'm really sorry for that. And we will see that this will not happen again. So may I proceed? All right, I understand that you have been referred by your GP because you want to discuss about sterilization procedure. Am I right? May I know why do you want to have sterilization? So I do understand your concerns, and in a moment I'll try to address all your concerns. Before that, is it okay if I ask you a few questions and then discuss the sterilization procedure in detail? I will also give the written information leaflet about the procedure and write back to the GP about our mutually agreed care plan. Is that okay? So, may I know, are you otherwise fit and well? And when was the last period? How are your periods otherwise? Are you updated with your cervical screening? Have you been using any birth control method? So, she will say she forgets to take the pill. So just keep in mind that when you will counsel about sterilization, you can say that yes, the advantage of sterilization procedure is that you don't have to remember to take the pills. Okay. And pardon me to ask, any sexually shared infection, abnormal vaginal discharge? I can see that you have 2 children and you had 2 cesarean section. Am I right? So may I know why you had the cesarean and how was your recovery? Are you following GP for any medical condition like diabetes, high blood pressure? Are you on any medication? Any allergy to food, drug, or metal? Any other surgery on your tummy or on below? How about your partner and the support at home? And how have you been feeling lately? Thanks for these informations. Would you like to add anything important? I would like to examine you with your permission and in the presence of chaperone, just to assess your general health and condition. Will that be okay? So if examination findings are given, yes, I can see that your blood pressure and heart rate is normal, and also your weight-height ratio is 24. Am I right? So now regarding the sterilization procedure, may I know, do you have any idea about it? Yes, you're right. It is a permanent method of birth control, and the good thing is that you don't have to remember to take the pills. However, there is some risk of surgery and anesthesia. So is it okay if I discuss about the procedure in detail? This is done by the keyhole surgery as a day care procedure. And as you said, clips and rings are applied in the tubes, or sometimes tubes can be cut and stitched. Am I clear so far? There is some risk of surgery, like you can have bleeding, infection, pain, injury to the internal organs, bowel, bladder, or blood vessel. It can be technically difficult in your case because you had previous 2 cesarean sections, and sometimes there can be failure to do the procedure. Although it is a very effective method of contraception, but there is some chance that it may fail. Failure rate is 1 in 200 procedures. If it fails, the pregnancy can occur outside the womb, which is known as ectopic pregnancy. Have you heard about it? Any questions so far? Okay, and what about the other concerning factors? Sometimes patients come back to us for the reversal because of some unpredictable life events, like kids falling sick, or sorry to say, if there can be a breakup in the relationship or having a new partner. And also, we have seen that there is high chance of regret in future, particularly in young patients. Am I making sense? If you wish, it can be reversed in future, but it may or may not be successful. And if it is successful again, then there is risk of pregnancy occurring outside the womb, that is ectopic. Also, reversal is not funded by the NHS. And am I clear so far? Any questions? So there are other methods of contraception, which are known as long-acting contraceptive methods. Do you have an idea about them? These are very effective methods, and they're as effective as the sterilization process. These are the copper coil, which can be used for 8 to 10 years, and Harborne coil, Mirena, which can be used for 8 years, and both of them can be placed inside the womb. There is an implant which can be fitted in your arm. It is effective for 3 years. Then we have injectable methods taken every 3 months. Would you like to know more about them? No, not as of now. So if you wish to plan pregnancy in future, you can stop using them anytime. Also, we have another option of male sterilization, and this can be done if your partner agrees. So if you wish, I can explain the procedure in details. Any questions so far? All right. So if she's still very much concerned and not able to make decision, then you can offer her appointment with the counselors. I will be documenting the discussion in the case notes, arrange the follow-up appointment. If she's adamant to have sterilization, because this is like a negotiating station. So in those cases, you can arrange appointment with the consultant, yes, if she says, I will think about it, and like she's not so adamant, then you can say, okay, so we can arrange another appointment, and I would be happy to see you again after a few weeks' time. That's all. All right, so we are done with 6 stations. Well done, all of you. Any questions? Okay, so next, what we are going to have, let me see. Early pregnancy care. Okay, after that, oncology. So I will share the stations. We will meet at the same time on Monday. Right. Okay, thank you. Thank you, everyone. Good night. Keep practicing.